Okay, so this machine is the CPAP machine. Okay, this device only delivers CPAP. Okay, we have another ventilator can deliver BiPAP, but this one just can deliver CPAP. Okay, so I will tell you how to use that and demonstrate what's the CPAP and how to set up. Okay, so this machine require this power line connecting here and connecting with the power. And also the other thing is the tubing should be connected here. Okay, so they have a commercial. This is a commercial tubing. So they have a hole here. So we need to plug in this part to this hole. Okay, so plug this part. Okay, that's it. And also the other thing is humidification. So this one is their humidifier. Okay, so we need to open it, press this part, and then open it and put the drinking water inside, the same things. Okay, and close it, and then put it here. Okay. Okay, and the next step is connecting the tube to the mask. But I'd like to mention some important things. The first is that this one is used to connect the oxygen tube. So we need this adapter. Okay, this is called oxygen adapter, this one. Okay, I bring this from Taiwan. Okay, because I know your ventilator don't have this one. Okay, so connect this adapter with the mask. Okay, and this mask have some function. The first part is you can see the hole around here. The hole around here. Okay, this is for exhalation. Okay, because this is just a single circuit. So the patient inhale from this line and exhale from this part. Okay, and another one is that this part have one-way valve over here. So we can see the valve over here. Okay, and this is called anti-suffocating valve, and this is for if the machine is shut down, the patient can breathe room air from this port. Okay, but if the machine is working, the positive pressure will deliver from this pump, from this side, and it will close this room air port. So this port just for if this machine is not working and the patient can breathe room air, not suffocating. Okay, so we need to connect the tube over here and the oxygen adapter. So this adapter is used to connect this one small oxygen tube over here, and then connect with the flow meter on the wall. Okay. So there's a mask here, and then is to turn on the machine on the top. Okay, here. Let's see. So usually when we plug in, it automatically switch on, and if not, we can press this button. Okay. So we can see they have the menu over here, but because now we like to set up, so they have one secret about this ventilator is to press this knob, and this is a home page button. Okay, press these two buttons together to in clinical menu. Okay, so now this menu is for the patient or for the family member only. Okay, so we need to enter another mode. So press these two buttons together and wait for 3 to 5 seconds. Okay, so now you can see that this is now it's clinical menu over here. Okay, so now it's clinical mode. Okay, so we can do adjustment. Okay, press these two buttons. Okay, and then we can enter the setting over here. Press the button again. Okay, so I think they just have one mode in this machine. This is called CPAP. Okay, so now it's already a CPAP mode over here. And then this set pressure means that the levels of CPAP you want to deliver to a patient, okay? And usually we start from maybe from 5 to 10, okay, 5 to 10. Okay, so we can start from, we can set 10, okay, maybe 10. And the other thing is mask. And mask means that we use this one. And this cover nose, both nose and mouth. So this is called full face mask. Okay, they have other option. The first one is pillow. Pillow means that it's like a nasal cannula and just cover the nose, okay? And the other thing is the nasal, we just cover the nose only, okay? So, but we use the mask here. So usually in ICU, we need to cover both mouth and nose, okay? So we select the full face. Full face means that this one is full face. So we select the full face interface, okay? And I think other thing is just auto. We don't need to change it. Okay, so auto. Set pressure. Set pressure means that because our CPAP level now is 10, okay, but sometimes the patient cannot tolerate this high pressure. So if we set pressure, start pressure around 4, means that the ventilator will deliver 4 centimeter water of pressure initially, and then gradually increase the pressure to 10. Okay, so not directly give the patient 10 centimeter water. So it's just for comfortable, okay? So maybe you can start from 4, and our thing is just auto. I think that's fine. Okay, and then after that we can shift back to home, exit, clinical menu. Okay, and we can start, press this button to start. Okay, so you can see that the pressure now is not 10, it's 4. Okay, so it requires some time. It's auto, maybe that you require, usually in this manual, it say you require 30 minutes to let the pressure from 4 to 10. Okay, so now you can feel the pressure. You can feel the pressure, but this pressure is not high. Let me try again. Okay, so this pressure, you feel a lot of air come out, but this pressure just fall. So you can imagine that if the pressure is 10, maybe it's too high. Okay, but some patients require this high pressure to expand their lung. Okay, so it just deliver one constant levels of pressure only. Okay, so we can see that what's the CPAP mean? If we set the CPAP level around maybe 5 to 10 centimeter water with a mask, okay? And as I use in this ventilator, I set 10 centimeter water, okay? If like some patient just use oxygen therapy only, sometimes this is their alveoli, okay? And this is normal one, okay, normal. And oxygen can go into the alveoli. And below the alveoli is capillary, so it's a perfusion. So we call this is ventilation. This is perfusion, and perfusion usually we use Q to symbolize perfusion. So this is called VQ matching. This is normal people, okay, like us. And if the patient have some sputum accumulate in the lung or have some pneumonia or some kind of obstructive disease, this can cause obstruction of the airway, okay? So these alveoli cannot expand very well. So some alveoli decrease volume, Okay, and we still have perfusion over here. So now the perfusion is normal, so the Q is the same as normal people. Okay, but now the ventilation is decreased due to some obstructive disease or pneumonia, some kinds of disease. So the ventilation is decreased. So I usually write like this, small v over here. So this is called VQ mismatching. Okay, so like these kinds of patient, you will see the saturation decrease. That's why we require oxygen therapy. Okay, but in some people, they have more severe disease. Okay, they cause maybe total obstruction. Okay, and this is called atelectasis or lung collapse. So this causes no air inside the alveoli, but the patient still have perfusion. So the Q is normal. Okay, but the patient don't have any ventilation. Not have ventilation. So in this situation, we call this is a shunt. Okay, shunt means that the patient have perfusion, but they don't have any ventilation. Okay, this is called shunt. So if we just give oxygen therapy, we give maybe by mask or by nasal cannula, it's just a low flow. So the oxygen, because this part just partial collapse, so the oxygen can enter the lung, okay, if you give high level of oxygen. But if this is total obstruction, this oxygen cannot enter the lung because atelectasis lung collapse over here, okay? So the strategy for us is to open the lung first, okay? We need positive pressure to open the lung, okay? So that's why we require CPAP, give the patient one positive pressure, okay? So if I set 10 centimeter water, means that I deliver not just oxygen, I deliver oxygen plus positive pressure, okay? And the function of positive pressure is to open this collapse alveoli. Okay, so we use positive pressure, 10 of positive pressure. I say this is therapy, use CPAP therapy. And we use positive pressure to open the alveoli. So now in alveoli, they have 10 centimeter water of pressure during inspiratory phase and expiratory phase. Okay, so during inspiration and expiration, the patient have 10 centimeter water of pressure. So this is a function of CPAP. Okay, so this part is total suction, but now we deliver 10 centimeter water of pressure. So it is 10 alveoli as well as airway. So airway can also be this 10. So now positive pressure that the patient's airway from total obstruction to partial obstruction. So now the oxygen can be delivered into the lung, okay, to improve the mismatching. Okay, so this is why we require CPAP, okay? But the limitation, this is the benefit to use CPAP. So in ICU, in acute care setting, we can use CPAP in mild to moderate hypoxic respiratory failure or some heart failure patient because the fluid accumulate. Now maybe it's not obstruction, it's a fluid accumulate in the interstitial region. This can also cause the lung collapse, okay? And the same things, we require positive pressure to distend alveoli, okay? So the evidence is that if the patient is heart failure or mild to moderate hypoxic respiratory failure, type 1 respiratory failure, we can select CPAP to distend alveoli first and then give the oxygen, okay? But the limitation to use CPAP is that because during inspiration and expiration phase, it just deliver one pressure, okay, just 10 centimeter water. So if the patient use CPAP, just one pressure, so the patient don't have ventilation, If we like ventilation, like yesterday we talked about maybe pressure control PC, pressure control mode, we require two settings. The first is the inspiratory pressure. Second is the PEEP value, right? So during expiratory phase is this PEEP value. Maybe we set 5. Inspiratory pressure maybe 10. So during expiratory phase is 5 centimeter water. And during inspiratory phase is 5 plus 10. So the change of high pressure and low pressure means that the patient has ventilation, okay, to wash out carbon dioxide, to wash out CO2. Okay, but in CPAP, we just deliver one pressure. We don't have high pressure and low pressure. We just have one. So in these kinds of patients, because the ventilator did not give the patients enough ventilation. So the limitation to use CPAP is that if the patient combined with CO2 retention, higher level of CO2, we cannot use CPAP. We need to use the BiPAP or pressure control. Okay, so this is an important limitation to use CPAP. Okay. So the benefit of CPAP is to distend the lung, to let oxygen easily enter the lung. Okay, but the limitation to use CPAP is that if the patient have CO2 retention, we just use one pressure, it's hard to wash out carbon dioxide. So we need to shift to another mode. I will talk about BiPAP next week. You can feel about the pressure. Okay, they have a two strap over here. It covers the forehead. Yeah, and this part cover the chin or mandible over here. These two. Okay, so I think I can disconnect one side. Okay, I already connect the bacteria filter. Yeah. Okay. Oh, it's fitted. It's fit well. Okay, beautiful. Let me connect it and the other side. This part. So I think now the pressure is just 4. Okay, and the tip is that we need to pull two sides of strap together to let pressure equally on the forehead and on the chin. Okay. Okay, how do you feel? Is that okay for you? Okay, so maybe I need to change it. Press these 2 buttons. Clinical setting, CPAP. Okay, so now the pressure just 4. But I need you feel the target pressure of the patient. Okay, let's see. So now its target pressure will be 10. Okay. So you will feel some leakage over here, right? Okay. But I think we can tolerate some leakage. Okay, that's fine. Small leakage, that's fine. Okay, how about 10? Do you feel it's hard to breathe out? Oh, okay, that's right, because you are normal people. I have one character over here, and this is smile over here. Means that the mask seal well. Okay, so we can accept some leakage. That's fine. You will feel that you still require yourself to breathe in and breathe out. Okay, so you can imagine that if the patient wear this mask, but they have CO2 retention, maybe for them it's hard to wash out carbon dioxide, or they have a poor muscle force to wash out, to do ventilation to wash out CO2. Okay, yeah, I can show you. this part have a maximum level over here. So we just pour the water below this maximum level. Okay, just this part. Okay.
We should distill water.
Yeah, distill water over drinking water in this hospital. At least drinking water. The patient, maybe they can also use the bacteria filter, but usually we connect bacteria filter before humidify. Okay, before this one. Okay, so maybe we can connect here. Okay, connect this part. Okay.
I usually saw that people with sleep apnea.
Yeah, sure. This machine is the first use for this machine is used for obstructive sleep apnea. So they have one function here. They have a data. I think. Let me see. You can see the sleep. You can see here. This is a sleep report. So when the patient wear this mask during sleep at night, the ventilator can estimate the apnea time of the patient. Okay, how many times? This is called apnea hypopnea index. Did you know this part? AHI, apnea hypopnea index means that the higher level means that the patient have higher risk to get obstructive sleep apnea. So they can detect the apnea to the patient, okay, and record in this part, so they can deliver this report to the doctor, to readjust the CPAP level.